Today's ICD-10 quick coding tip focuses on the three main principles that coders must consider when selecting the principal diagnosis. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. When determining the principal diagnosis, coders must take into account three important factors: the circumstances of admission, the diagnosis determined after study, and any relevant coding conventions. This is important because, as stated in the ICD-10 guidelines, the circumstances surrounding the inpatient admission always dictate the selection of the principal diagnosis, and the principal diagnosis is defined as that condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital. The guideline then goes on to say that the sequencing of codes must adhere to coding conventions which take priority over the principal diagnosis guideline itself. The first factor to consider when determining the principal diagnosis is to carefully evaluate the circumstances surrounding the inpatient admission to ensure that the diagnosis selected as principal aligns with the primary factors that led to the patient's hospitalization. You must consider the reasons behind the physician's decision to admit the patient to the hospital for inpatient care. Ask yourself what specific situation or condition was so severe that it necessitated an inpatient hospital admission instead of outpatient or observation care. Let's take a look at an example. In this scenario, the patient, who is 8 years old, was recently diagnosed by their family physician with strep pharyngitis. They're brought to the emergency room by their parents after several days of not eating or drinking very much due to severe sore throat. The emergency department physician notes that the patient has a fever and is very lethargic and continues to decline fluids by mouth due to the throat pain. The decision to admit the patient to the hospital for severe dehydration is made. The H&P documents that the patient presented with fever, lethargy, and malaise secondary to dehydration. Plan is to hydrate the patient with IV fluids and continue amoxicillin 5-day course from home to treat the strep pharyngitis. The discharge diagnosis is dehydration and strep pharyngitis. Let's determine the principal diagnosis for this case. First, we need to consider the circumstances surrounding the admission. The child presented with a fever and exhibited lethargy along with the inability to take in fluids due to throat pain caused by strep pharyngitis. As a consequence, dehydration occurred, necessitating treatment, and the patient was admitted. The treatment involved administering IV fluids and continuing antibiotics for the strep throat, which had already been initiated prior to hospitalization. The discharge diagnosis indicated both dehydration and strep pharyngitis. In selecting the principal diagnosis, we must consider which condition warranted inpatient care and which could have been managed in an outpatient setting. Dehydration, being a more severe condition, required inpatient care. On the other hand, the strep pharyngitis could have continued being treated as an outpatient. Therefore, the principal diagnosis for this scenario is dehydration, with strep pharyngitis assigned as a secondary diagnosis. Our next consideration when determining the principal diagnosis is to apply the definition of principal diagnosis as that condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. The concept of after study can sometimes be a source of confusion for coders. What exactly does after study mean? It means that the physician may not identify the definitive diagnosis until after workup is complete. However, this does not mean that any condition that is identified after workup can be designated as the principal diagnosis. The after study diagnosis should explain the signs, symptoms, or circumstances that led to the patient's admission. Let's look at a scenario that demonstrates this concept. The patient presents to the emergency room with severe headache and is admitted to the hospital for evaluation and treatment. Imaging reveals a cerebral aneurysm, and there is concern that this could be the source of the headache. Cerebral angiography is done to evaluate the aneurysm, and angiography shows that the aneurysm is small and stable with no need for intervention. The physician documents that the aneurysm is not the source of the patient's headache and that the patient in fact has a migraine. Migraine cocktail is started and the headache resolves. The discharge diagnosis is migraine and cerebral aneurysm. To determine the principal diagnosis for this scenario, we must consider both the circumstances surrounding the admission and the diagnosis the physician identifies after study that explains the signs, symptoms, or circumstances that led to the patient's admission. In this particular case, the patient was admitted for the purpose of evaluating and treating a severe headache. During the initial evaluation process, an imaging scan revealed the presence of a cerebral aneurysm, and at this point the physician was considering both migraine and cerebral aneurysm as potential causes of the headache. Further evaluation of the cerebral aneurysm was conducted, and it was determined that it was not the underlying cause of the headache. After careful study, the diagnosis responsible for the admission symptom of severe headache was identified as a migraine. Therefore, the principal diagnosis in this case is the migraine, with the cerebral aneurysm being assigned as a secondary diagnosis. Our last consideration when determining the principal diagnosis is to review any coding conventions in the tabular list or alphabetic index that direct sequencing, since these instructions do take precedence over the official coding guidelines. This means that any rules regarding sequencing must strictly be followed, even if it results in a principal diagnosis that does not match with the circumstances of admission or definition of principal diagnosis. In order to do this, we must first select the principal diagnosis based on circumstances of admission and diagnosis after study, and then check for any instructional notes to ensure proper sequencing prior to final principal diagnosis assignment. Let's look at a scenario that demonstrates how coding conventions can influence the principal diagnosis selection. In this scenario, the patient who has known breast cancer presents with shortness of breath, and imaging shows a large pleural effusion. The patient is admitted for evaluation and treatment of the effusion. Thoracentesis is performed to drain the effusion, and cytology comes back positive for cancer cells. The discharge diagnosis is malignant pleural effusion and breast cancer. To determine the principal diagnosis for this scenario, we must first determine the principal diagnosis based on the circumstances of admission and diagnosis after study. The patient was admitted for the purpose of treating a pleural effusion, which was subsequently drained and determined to be a malignant pleural effusion associated with the patient's pre-existing cancer. The discharge diagnosis includes both malignant pleural effusion and cancer. The diagnosis that was responsible for the admission and meets the definition of the principal diagnosis is the malignant pleural effusion. However, in this case, there is an instructional note found in the tabular for code J910, malignant pleural effusion, directing the coder to code first underlying neoplasm. And so despite the fact that the malignant pleural effusion prompted the admission, the coding convention mandates that we prioritize coding the underlying neoplasm first. In this case, the cancer takes precedence as the principal diagnosis, while the malignant pleural effusion is sequenced as a secondary diagnosis. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up. And if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.